Which one should I get? Follicular unit extraction or strip? My surgeon is an expert in strip, but has also been doing FUE. I am 19. Which one should I get? FUE or strip? I've heard that strip has better results and damages donor area less than FUE does. Advice needed. Thanks for your time. You guys have been of great help throughout.
Thank you for your question. Your question is about FUE versus a strip method for hair transplant. And you showed some really good photos of the level of your hair loss. And you're 19 years old. So to just answer the question about strip versus FUE, just for the sake of clarification. I don't think there's a single hair transplant surgeon who would not concede that the number of hairs and viable hairs are considerably greater, have a greater yield in the strip method versus FUEs. FUEs are almost a cyclical return to the way that hair transplant was done in the 90s with punch grafts, but now they're just smaller punches. That being said, I want to just discuss with you a little bit about what we do in our practice when someone who's 19 years old comes to us with the degree of hair loss that you have. I do not in any way want to disrespect your transplant surgeon, but I think that given what we can inform you about, I think you'll find there is some value in learning about this. So what I'm talking about is someone like yourself who has lost so much hair by the age of 19. You have to wonder exactly where will you be a year from now, 2 years from now, 3 years from now. So what I'm talking about is age of onset, which is early, and the rate of progression, which appears to be fast. Your hair transplant area is limited, and therefore your donor area cannot meet the amount of hair needed to cover the scalp of the amount of hair that's been lost. So we have to explore what are the options to actually slow down or stop the progression. Currently, in the United States, finasteride and minoxidil are the two drugs used for male pattern hair loss. When you look at finasteride, finasteride is a drug that's taken orally that essentially affects DHT or dihydrotestosterone sensitive hair follicles. Long story short, essentially if your hair loss is DHT sensitive, you will respond to finasteride. However, at the current time, so many people are concerned about the medical studies that showed a long-term sexual side effect or dysfunction from taking finasteride that in our practice, most men who come in are not interested in taking finasteride, which means there's almost no medical intervention available. Topical minoxidil is not going to stop the progression of hair loss. It can prolong the appearance of the thinning hair on the scalp, so it looks like there's more hair, but it will not reverse hair thinning. In our practice, someone like yourself, I would offer you the opportunity to do something called hair regeneration. Hair regeneration is a method that we developed in our practice using a combination of extracellular matrix, platelet-rich plasma to stop and reverse hair thinning wherever there is existing hair. Now this is very different from what is currently the standard of care for hair loss treatment. For most male pattern hair loss patients who are doing research, they learn about hair transplant and then they look for the best possible hair transplant. But understand that no matter how old you are when you have a hair transplant, it is a limited solution and it is a temporary solution by virtue of the reality that you will progressively lose hair. Many people don't even consider hair transplant because they don't want the pluggy look. And the pluggy look is a look we're all familiar with, where someone looks like they have like doll's head hair, where it just looks like these plugs were placed in a way that is very obvious. The reality is the majority of the patients or people who have had this actually used to have more hair. But the problem was that the hair thinned, and it caused the hair plugs to become obvious. So, with that being said, in our practice, we do a microscopic evaluation of the scalp, and we identify for our patients the potential hair that can thicken from hair regeneration. And we have taken patients who are very advanced in their hair loss, and we have been absolutely impressed by the amount of hair volume they've been able to achieve in spite of how far along they were. So basically we believe strongly that as long as there's potential, there is an opportunity to get improvement with hair regeneration. And we've reached a point where we would clearly be able to show the benefit of hair regeneration as outweighing the benefits of hair transplant in terms of volume of hair. Because when you think about it, Mother Nature already created hair in its natural orientation, and because of the density that's there, the potential for growth and the volume that's created can never be duplicated by a surgeon. And so with every patient, even if they want to do a transplant, and through their examination we can determine whether or not how much they would probably benefit from hair regeneration. Even if they're a candidate for transplant, our strategy is to first do hair regeneration, allow 18 months to transpire, and then see where they're at. And this treatment is a one-time treatment. And with 3 to 5 years of data, we can definitely stand behind the benefit lasting at least 3 years and up to 5 years. And the reason I say that is in the first 2 years of this development, there weren't that many patients. So we can't say definitively 5 years, but we have rarely seen anyone who needed additional treatment or additional injection. So with that understanding, you can now consider an alternative to transplant or consider a strategy, because with hair regeneration, what are we doing? We're not only reversing the thinning of the hair and creating more scalp coverage, but we're stopping the progression. That means that even if and when you choose a transplant, you can be more strategic and efficient and effective with the grafts, because remember, you only have a limited donor area. The donor area is limited by the band of hair that you would see on the baldest man you've ever seen, because that is truly the genetically resistant area. Another disadvantage of FUEs is that by design you have to go outside of the genetically resistant area, and that's why FUEs are basically, as far as I'm concerned, it's a ticking time bomb where people are not going to get the density that they want, lose a lot of hair from transection or cutting of the grafts, and not get the yield that they would hope for. And this has already been proven by the International Society of Hair Restoration survey of patients and doctors, or of the members, I should say, who have conceded that 65% of patients want more density. So, that being said, hair regeneration can be that strategic use of a method to stop the progression, restore volume, and then consider transplantation. But I'm very hesitant in my practice to transplant someone this young. I would rather do hair regeneration, wait it out, watch and see if there is any progression, and then consider a transplant if appropriate. understanding what the limitations are. So I know I've given you some new information, and I hope that will help guide you in your journey of treating your hair loss. So I hope that was helpful. I wish you the best of luck, and thank you for your question.